Greetings, everybody, and welcome to this week's Mental Health Moment with Dr. Matt. As always, I hope this message finds you well. So, unless you've been ignoring all of my posts since May 1st, as well as many others I'm sure that you've seen come across your feed to this point, May is Mental Health Awareness Month. Beginning in 1949, Mental Health Awareness Month is a means to destigmatize mental health and addictive disorders, as well as spreading appropriate knowledge on the topic. While not every single person watching this will have a diagnosable mental health condition or has had one throughout the past, at one point or another, all of us can use some additional assistance as we go through various life challenges. And also, it is highly likely that you know another individual struggling. So, bringing awareness around the topic is healthy for both self as well as others. And while mental health awareness isn't something that's just a May thing, I think it should be an every single day thing, 365, 24/7, or even 366, depending on leap year. We do need to have these types of months to call attention in hopes of getting the ball rolling for individuals. So it's important that throughout the year, not just in May, you continue to check in on yourself. So one of the things that people do annually without even thinking about it is going in to see their physician to have a wellness check. Well, one of the things that they do quite frequently now, at least at the physician that I see, is they have a mental health questionnaire that kicks off your physical, your office visit, and so on. And this is oftentimes the Patient Health Questionnaire 9, the PHQ-9. And while I discourage trying to utilize this as a diagnostic measure for yourself, we're not self-diagnosing, we want to ensure that we have some awareness, that we're checking in with ourselves often. It's one thing to go ahead and check your weight. It's another thing to go and get your blood drawn, urine checked, all sorts of other different tests. But we need to frequently check in with our mental health here as well. And a very simple form that you can use that they have at the doctor's office is the PHQ-9, which I've pulled up right here. It's a simple 9-question questionnaire, and it begins with 1, you experience little interest or pleasure in doing things. 2, feeling down, depressed, or hopeless. 3, trouble falling asleep or staying asleep or sleeping too much. 4, feeling tired or having little energy. 5, poor appetite or overeating. 6, feeling bad about yourself or that you are a failure or have let yourself or your family down. 7, trouble concentrating on things such as reading the newspaper or watching television. 8, moving or speaking so slowly that other people could have noticed, or the opposite, being so fidgety or restless that you've been moving around a lot more than usual. And number 9, thoughts that you would rather be better off dead or of hurting yourself. And then from there, you go ahead and tally your score and consider how difficult were each of these problems that you had. So it's going to be more so about the severity of the problems. Now, do know that on any given day, any given week, there can be some variation. Typically, when we use a PHQ-9, we're considering your experience over the past 2 weeks. However, I will say that it's an indicator the longer you've been experiencing a higher number of symptoms to greater severity. So if you've been feeling this way for 2 weeks, 3 weeks, a month, 6 months, a year, it's highly likely that there is something worth checking out. So one of the things I do encourage is when you do go into your physician and you're ever prompted with the PHQ-9, answer it honestly. If you have the opportunity and you're not feeling very well, go ahead and check in with it yourself. And from there, again, do not use this to self-diagnose. Use that as an indication that maybe I should go and speak to somebody and schedule an appointment with a professional. The more often that we check in with ourselves and we have that awareness, the better able we are to mitigate problems before they grow in severity. Remember, we want to care about one another, but ultimately it does begin with caring about yourself. And the PHQ-9 is an excellent opportunity for you to be able to recognize whether or not something's going wrong. And here's just one tip of many that you can have throughout Mental Health Awareness Month. I'll be sharing more videos as well as posts and so on, but I do encourage you to check out that from other people as well. Here's to a wonderful rest of your day and week. Take care.